Thanks, Ethel. I hope everybody's well. Thanks for the opportunity to get together with you online and review some of what has been going on recently. It's been a topsy-turvy time, of course, and lots of things changing rapidly, and unfortunately too rapidly to really track very well in housing market data, which tend to be monthly in nature. So I'm sure later this week we'll be getting updates from all the local boards and associations of realtors, and I'd be paying attention to what the April numbers look like, because those are going to summarize everything that's happened. March was sort of a transition month as we went off the cliff together, and I think the next couple months really will be the bottom of the descent in economic activity. Actually, April might be that moment. And as people talk about reopening in May and looking out over the summer, whatever the new normal is going to be should start to emerge. With any luck, it'll be a prudent return with the appropriate safety protocols. But that, of course, remains a subject of future discussion. I'm going to switch on over to the slides now, and now I need to remind myself how to do that. Here we go. So what I prepared is the usual set of slides to illustrate both what I see going on and what I believe it's reasonable to begin thinking about in terms of where things are going. There's just a tremendous amount of certainty, so I don't want to oversell that. The fact of the matter is that we have precedents that are quantifiable and measurable and allow us to do some of the analytics. But as far as I can tell, not so much in the dimensions that are pertinent to housing. For example, the valuation and transactions kinds of statistics we typically focus on. I will talk about that a little bit at the end. And in fact, the title of this presentation, which we dreamt up about a month ago, is a bit of a bait and switch, because now it's going to be, instead of housing, the Hawaii economy, and COVID-19, it's going to be COVID-19, the Hawaii economy, and housing. But aside from the order being wrong, we're going to try to cover all of those bases. So the cover shot here is an image from October of 1918, in the midst of the first major wave. There's some debate in the epidemiological, historical community, the people who look back at these older data sets, about when the influenza epidemic began. And as we'll see in a second, it appears to have manifested itself in Hawaii as late as 1920, but exactly a century ago. But the peak for most US cities and in the US historical experience was in the fall of 1918, from which this image of a typist in New York is taken from the National Archives. And indeed, if you just go to the National Archives, by the way, and look at their image gallery, it's actually quite fascinating, because it's so reminiscent of, I mean, it's so like today, and which is all the more amazing because, I mean, honestly, not many of us really knew what to expect, even including those of us who had studied the issue. But as I say, you just have to look back at what people were doing 100 years ago to realize that in some sense, we've all been here before, or at least our grandparents, and that's actually my starting point. Let's see if I can get this to advance. Here we go. So I'm going to tell a story of an experience that my grandfather had 100 years ago, because it sort of frames the way I've approached this. 100 years ago, my grandfather was a member of the American Expeditionary Force, which was sent abroad in America's participation towards the end of World War I, sent abroad to Europe. This is an image, again, from the National Archives of the 39th Regiment from Seattle, marching to the train station, I presume, from which they would be transported across the country. And there they are in surgical masks. My grandfather was a college student in the late 19 teens and started out at what was then called Western Illinois Normal School, what is today Western Illinois University, where he spent his freshman and sophomore years. In the summer of 1916, he worked for the Geological Survey, and then in the summer of 1917, worked on a project called Win the War with Wheat, spending the summer and most of the fall in Saskatchewan on a massive wheat farm. After which he got scarlet fever, could not go back to school in the winter semester of 1918, and then when he got better, was drafted. In March, he joined the Army, went to 6 weeks of boot camp, and in May found himself in France, where he saw action at Belleau Wood, Saint-Thierry, I think, and then the final battle of the war, the Battle of the Meuse-Argonne. He was stationed here near a village and in Chepy, and yes, he was the original Instagram dude. He brought a Brownie camera with him, was wounded on the second day of the Battle of the Meuse-Argonne, spent the fall in a hospital in France as the influenza virus ravaged the world, and briefly was allowed to go home for the holidays, and then spent 6 months in rehab in a VA hospital in Chicago. So most of that time, he, with the influenza virus pandemic sweeping the planet, he was at war and in the hospital. He went back 30 years later to revisit the scene of his experiences in the Battle of the Meuse-Argonne. And he took these pictures, and he has these notes scribbled on the Kodachromes. There's amazingly well-preserved Kodachromes, right to the spot where he was wounded. All to motivate an examination of that experience as our starting point for today's discussion. When I used to ask my grandfather about his experiences in the war, and if you were a kid, you know, if you were a child of the 50s and 60s, it was still kind of cool. You know, there were war shows on television and whatnot. I would say that America's military service personnel were held in somewhat higher regard. An unfortunate legacy of the Vietnam War experience that may be justifiable. But whenever I would ask my grandfather to relay those experiences to me as a kid, the takeaway I got was that the flu pandemic was the thing that made the biggest impression on him. And this was a guy who'd been drafted, had 6 weeks of boot camp, followed by 6 weeks of hard fighting in which he was wounded and spent 9 months in hospitals. And his takeaway was the flu pandemic was worse. And it just mystified me until this recent experience, when I realized these data I've compiled in the past in talking with professional groups in the health services and whatnot. This slide, for example, I made for a conference of the federal court, which is held every year. And to their credit, the topic a couple of years ago in their conference was biological risk, biological event risk. If you look at the data, what you see is half of all American service members in World War I died from disease, not battle, and a third of all American service personnel who died in World War I never got to France. A third of them died in the US. This means they died in boot camp or on troop ships. Well, maybe even not even on the troop ships. The point is that influenza in the pandemic of 1918-1919 ravaged American military personnel to an extent greater than the actual battlefield death and injury. The data we have for that period is actually quite remarkable. And in a paper published in 2007, a number of co-authors compiled what you're seeing here, which are deaths in excess of the daily norm for the period September 8, 1918 through February, the last week in February, 1919. So about 6 months of data. And I know the story from Denver because that's where my grandparents ended up settling. And I've read about this recently. Actually, my kids live in Denver, so I've been all paranoid about what they're going through as a parent. But the first case of influenza was identified in Denver on September 27th, 1918. A student at the University of Denver had traveled from Chicago, her hometown, and that was case number 1. And we'll come back to Denver in a second, because as you can see in these data, which are aggregated, they've clustered East Coast cities, Midwest and Southern cities, Denver being included in the Midwest in this agglomeration, and then a half dozen of Western cities. You can see a familiar pattern in which an initial infectious wave, and in this case, deaths arising from that infection, spikes about a month after presenting itself. Social distancing was put in place in all of these cities to one extent or another on varying timetables, which we'll see show up in the data later. Masks were distributed. People were encouraged to behave appropriately under the circumstances. All the things we're familiar with today. Economies were in lockdown. And then around November, people started getting antsy. There were protests in Denver against the shutdown of businesses. And so jurisdictions, in many cases, relented, reopened, and did so too early. And there you have the second waves that we're now anticipating are going to happen in the United States for the same reasons they did 100 years ago, as if nobody learned from this experience. It's even fascinating to see that the first wave and second wave, did I get that right? That's not true. The first wave peaked in the East and then went across the country to the Midwest and the West, but that it was the Midwest that, having given up earlier, confronted a second wave much sooner than was the case on the West Coast, although the West Coast second wave was pretty bad, as you can see there, and happened about 90 days after the first wave, or I'm sorry, about 4 months after the first wave. All of these data, and by the way, a version of this slideshow will be provided to the Hawaii Association of Realtors in a PDF format. You're welcome to pick up a copy. The links to all of the references in each slide are at the bottom, and those are active links, so you can click on them and go straight to the source. These graphics I've stolen from National Geographic, who compiled the data from the underlying paper, and both are sourced here. So again, you can see a varying experience across 4 major cities: Philadelphia on the left, St. Louis on the right. San Francisco and St. Louis had significant second waves, which we'll look at in a second across the country. Philadelphia had the most deaths associated with the first wave. New York, in that case, had begun its quarantine measures early, had embraced social distancing, and was able both to mitigate the first wave and to preempt, to a large extent, the second wave. The shaded area in each graph depicts the length of time that the city governments had social distancing measures in place. Okay, so these are 4 exemplars from across the country 100 years ago, and here is the entire data set. And I'll draw your attention to Denver, and just to the right of center, next to San Francisco in the top line, which, as I suggested, and Omaha below it. And in fact, as you look across, you'll see a number of cities where in the first wave, after having dissipated, led governments to release the people from the restrictions of social distancing and other protocols, and then had a much worse second wave. In fact, the story in Denver is that after these demonstrations around City Hall, and I can just imagine it in Denver, the Capitol with its golden dome sits on one side of the city square, and then City Hall on the opposite facing side. And you can imagine the protests out in the street, right out in the park, and the mayor deciding at the end of October that on Armistice Day, that when Armistice Day came, there would be a huge celebration. And of course, the war ended November 11th, 1918. Armistice Day, what we call Veterans Day today. And they had a gigantic block party and everybody got sick. And so their death rate spiked. I shouldn't laugh. So if you've been following the epidemiological models, now that the US is embracing this reopening, the estimates are that our death rate will double over the course of the summer from where it is today. And here we go. And that's what I would expect. I imagine it would be fascinating to get into the Hawaii data, and I just haven't had enough time or don't know the sources. But you can see the impact of the influenza event in Hawaii in 1920, the actual year 1920. If you just download the death rate, mortality rate for Hawaii over a period of a century ago, plus or minus 20 or 30 years. So I've got about 50 years of data here, showing the downward trend from the late 19th century, which of course, the past was a much more brutal world in which for people to inhabit. But guns, germs, and steel, I guess you would say, back in the late 1800s, where diseases, which most of which we've gotten rid of, right? Pertussis, isn't that whooping cough? Measles, we have vaccines for those. By the way, half the people in Hawaii have never lived in a world that didn't have vaccines. Think about that for a second. When I went to kindergarten, 500,000 people in America got measles every year, with half the population that America has today. So when I went to elementary school, 500,000 Americans got measles every year. And of course, in those days, this is right before the polio vaccine had come out, but none of the others. And so I remember having mumps. I remember having measles. I remember having German measles. I had them all. And yeah, trust me, you don't want to go back to that world. So that's the limits of my knowledge on Hawaii's experience with the influenza pandemic of a century ago. And I hope everybody's taking this stuff seriously. You'll notice Pearl Harbor, of course, the death rate fell to a low of 4 persons per 1,000 because there were so many healthy and American GIs in Hawaii at that moment. Today, the death rate, because of the boomers and aging, is about 7, so it'd be a little higher than you see the last data point here in 1950. At the time of the influenza pandemic, it was 15 per 1,000 and went up to about 17 or 18. So we'll see what happens. And by the way, 50 years after his experiences with war and the viral pandemic, my grandparents came out to Hawaii and helped start up the seed industry. And here we are 50 years after that. So let's see where Hawaii is today with the COVID experience. And by the way, I'm going to show you some models. They're just models. Models help clarify what's happening in the data. So let's approach it from that standpoint. I'm not saying I can predict anything, although I certainly hope I can imagine something that's plausible and maybe even probable. Here's the case count. We had our first case in Hawaii identified on March 7th. Testing in Hawaii began on Wednesday, March 4th. And I was in a meeting on March 6th with Dr. Desmond from the state's testing lab, among others. And I remember him saying that, we started testing 2 days ago. And I was like, what the hell? What have you guys been doing for the last month? Well, he said, CDC protocols essentially made it impossible. I mean, just nobody was meeting the threshold to warrant a test, which at that time was really high. I mean, you had to have been to a wet market in Wuhan, China to get a COVID-19 test back in February. And now, of course, we found out how lame that was. We should have been testing all along. We should be testing way more than we are. we're nowhere near that. And unfortunately, we'll see the consequences of that in a second. But at that time, in early March, once the testing got rolling and people began to be identified as not just having acquired the coronavirus, and in that case brought it back to Hawaii in early March, but that community spread had begun very rapidly. Literally within 2 weeks, you could see that the case counts were exponentiating. They were increasing at an exponential rate. And so this is a model I made at the time just to see, you know, where we were. And right around the time Governor Ige imposed the lockdown, as people call it, I think that was March 25th. If you estimated the path of the infections in Hawaii through March 24th, it was ramping up at an exponential rate. And so it was right at the correct moment that the jurisdictions adopted the appropriate interventions. But of course, I think at that time, it was more the fact that 2 weeks previous to the lockdown, you have to think about this for a second. The incubation period is about 14 days, plus or minus. And so some people, like, dude, trust me, when I got home from this meeting, I was like, oh, dude, I got on Amazon, I bought masks, I bought gloves, I bought, holy crap, I wish I'd bought toilet paper. But people immediately upon the report that cases had arrived in Hawaii or were present in Hawaii, people began to adopt, unilaterally adopt social distancing measures, change their behavior, and that showed up later in the month. And then of course the official lockdown helps turn the you know, bend the curve or whatever. So here are the data through yesterday. And in these, by the way, these charts have a half-life of 12 hours, because at noon today, there will be another data point. And, you know, technically I should re-estimate the entire model. But these are the daily data. You can see those first couple cases at the beginning of March. And then within a week or two, the bloom, so to speak. And then after a couple weeks of institutionalized social distancing and a shutdown. Sorry, I live between a fire station and a hospital, so that's what the sirens are all about. Totally took me off my train of thought here. By the end of March, you could see that the impact of the lockdown and social distancing was to begin knocking down those cases. Now, these are the case counts on a log scale, and you can see how at that time, when I was trying to figure out what was going on, a simple fit of a polynomial regression, you know, did a pretty good job. I have to say, it wasn't too bad. I had friends at the time, colleagues at the time with whom I would share this, and I'm not an epidemiologist. In fact, I've spent the last 2 months learning epidemiology. But I had friends tell me, you shouldn't show this to anybody because you don't know what you're doing. And I was like, that's right, I have no idea what I'm doing. And I've been reassured later that I was sort of close, but yes, I am no epidemiologist. So you guys, you need to listen to those guys. Here are the same data in levels, and you can see what's wrong with this simplistic notion of just fitting a polynomial to the data. If you look at it carefully, you see how the dots at the front end are like too high. They're like up at the top. Let's see, maybe this is where it is on your screen. And I don't know, you're looking at the graph, right? Not at me. Oh, that means I can do whatever I want here. I'm gonna have some coffee. You can see how the dots were too high at the, you know, initially. So while the model kind of fits, and you can see the bandwidth, that's like a 90% confidence interval. It's not that strong. You can see how it was off, and subsequently, I tried fitting other structures to this. This is basically a gamma distribution imposed over the data. And don't ask me why. It's just looking at it, it looked like a gamma distribution. More recently, I've embraced what's called the SIR model. That's really your basic sort of epidemic model, mathematical model. And when you fit that over the data, it, I think, captures what's been going on in this first wave. And maybe the last wave for Hawaii. I mean, with, you know, knock on wood, with any luck, this is it. But so you see that rapid increase, and then as the social distancing and economic lockdown measures are brought to bear, the virus essentially burns itself out. Now, let's remember the reason we're able to do this in Hawaii is because around the middle of March, we cut off all the airplanes. And if you look at the case count in terms of origins of the disease exposures, and these are the states officially published data, the so-called, we've been looking at what are called epic curves, epidemic curves. And this is the version that the state posts, the Department of Health. It's a day older, but you can see the blue part, which is people who brought the virus back to Hawaii because they were in Las Vegas or visiting family in Seattle. And then the red part is the community spread. Once it was here, then it spread to other people. And you can literally see that shift from blue to red as the original origins of the virus then spread to the rest of the population. And ultimately, as our social distancing measures have tamped that down. And here we are now facing this decision. You know, how do we reopen the airport? And how do we mitigate the introduction? How do we successfully execute containment, preventing the disease from even entering, and so that we don't have to revisit mitigation, which is what we just went through. We failed to contain in February, and therefore we had to mitigate in March and April. Let's not do this again. That's the idea. And we'll come back to a deeper discussion of some of that. You often see these data in cumulative counts, and now our Opala guys are going to drive by. Thank you for your service and the noise that your truck makes. And I've had to cut off this model after about a week because it's just not working anymore. The case counts, unfortunately, are higher than what I'm getting, again, with this simplistic model. So, you know, simple models are just, it's just a way of helping visualize where we're at. The fact that the case count cumulatively is tracking higher than the simple models suggests that this is getting more complicated. And here's what's been going on around the world. I'll use a few examples, but you can go to these links at the bottom and you can get the data, daily data from every country on the planet. It's amazing what you can do. We'll actually look at some of these in a second. Unfortunately, Hawaii is one of the best states in the worst country in the world, or one of the worst countries in the world, if you normalize, if you take the COVID case count and divide by the population. So these are cumulative cases per million persons. And you know, the winner of the COVID-19 sweepstakes right now is Taiwan, another island economy, take a hint. And another top performer is South Korea, which, even though technically it's not an island, because as a peninsula, it's cut off from overland access, is essentially an island economy. And we are lucky as islands that we can cut things off, but of course you can't do that forever, particularly when your principal export is tourism. And so we have this huge challenge in Hawaii of restoring tourism. And again, let me come back to that when we look at the tourism data. On a log scale, you can see these curves bending. That is, on a log scale, slopes are percent changes. So a straight line would be a rate of increase. And you can see even the US, which was going up at an exponential rate, right? A straight line in logs is actually exponential growth. But you can see how everybody's been able to bend the curve pretty much using the same techniques to one degree or another. And those who have implemented testing and tracing more aggressively are the ones that have succeeded more substantively. Here's the US against the rest of the world in per capita COVID cases. Here's South Korea, which flattened early and stayed flat. Here's Taiwan, which flattened, had a second wave, and then has since been able to put a lid on its cumulative case count. So the Bucks for Low guys and the smart Asian guys, the crazy rich Asians. This is New York, which everybody likes to say is the epicenter of the US current US experience, quite different, you recall, from 1918, where New York jumped on it early and managed it down. New York's problem was that when things got rolling back in late February, early March, they just hesitated long enough, maybe a week, for that acceleration you see around day 10 to 15, maybe day 13. You can see that acceleration in the case count, and that's the risk of being in a dense urban environment. And there's Hawaii. So unfortunately, the worst states and fortunately the best states so far. You hear a lot about other countries' experiences, and so I won't belabor the point about differences, but I thought it would be useful just to highlight a handful. And here I've ordered the countries in terms of deaths per thousand. So let's say we were actually concerned about people dying. And the death rate in Taiwan, as you can imagine, is the lowest. Here's an island with a population of 24 million, and they have 438 cases. I live on another island, Oahu, which has 1.4 million persons. I'm sorry, 1 million persons, almost 1 million persons, and has 400 something cases. So 24 million, 400 something cases, and 1 million, 400 something cases. And okay, that's, listen to the smart kids. That's why they got the good grades in calculus. Across the page, you'll see on the right column, there's the US, and then interestingly, Sweden, which has been conducting an experiment on itself, used itself as a guinea pig to see what happens when you don't institutionalize social distancing. So what Sweden chose strategically is to encourage social distancing, that is to advise its citizens that prudent and proper social behavior was to distance, and people don't seem to be wearing masks. The high schools and colleges were closed, and people have been studying from home. The elementary schools remained open because the risk exposure, or at least mortality exposure, is much lower among, or almost nil among children in the current, in the case of the current coronavirus. But you can see that they have this death rate that's like spooky, scary, 1,000 times higher than Taiwan's death rate. And it's because they chose a different path. And if you look at the other characteristics of Sweden which distinguish it, for example, Taiwan, South Korea, Germany, Canada, and Sweden all have some version of universal health care, right? Everybody has health coverage. So that's not it. So as you kind of go through, check through the list of things that are different, this informal approach, a more laissez-faire approach to social distancing, no institutionalization, no designation of what are they called? What's the, I can't even remember the necessary, and it's not necessary and unnecessary, but whatever. You know what I'm talking about. The restaurants are still open in Sweden. So I guess lessons learned, and now, as we suggested earlier, we're looking at, okay, we spent all this time talking about COVID, and we were going to get to some of the economics. So let me rush through a few more points here. If you're looking at the economy right now, the beatdown is pretty dramatic. This is the new GDP data set for the US, and it's starting out as bad as the Great Recession, and it probably in the second quarter will be as bad as the Great Depression. One important distinction between the current recession and the one a decade ago is that, as is customarily the case, the recession after the housing bubble of the late 2000s, early 2000s, 2007 through 2009, that recession and most recessions was investment-led. And as you all know, housing was at the forefront. this recession is consumption-led. It's really household decisions to cut back and stay at home, shelter in place, and all that other stuff. That makes it a very different recession, both in character, the composition of the output decline, and of course the magnitude. The forecast from the National Association for Business Economics for second quarter GDP growth is 25%, minus 25%, but the range is 0 to 50, minus 50%, and we can throw out the zero, guys, because we know that's not true. So we're probably looking at minus 25 to 50% decline in GDP at an annual rate in the second quarter. And this is what that looks in the context of the last 10 years, where we worried about Hawaii being a half percentage point lower than the US on average. And, you know, I mean, can't believe we even were concerned about that, but I was one of those guys. So this is what it looks like. The CBO, a Congressional Budget Office, anticipates that relative to their forecast 3 months earlier, output for the next couple of years will be 5 to 10% lower than we thought at the beginning of this year. And here are their numbers. They're looking, I'll circle here in the middle with my cursor. They're looking at a 40% decline. But of course, you hit bottom in the second quarter and then you climb out of it. Technically, the recovery actually begins this summer. Initially, it should be quite rapid as we get back to work. As the so-called non-essential businesses, I finally remembered the phrase, are allowed to reopen on whatever timetable officials decide is prudent. But as you can see in CBO's estimate, it takes us a while to get back. I want to use this as an opportunity to review a couple previous experiences. The last time Hawaii went through these types of experiences was in the 30 years between the First and Second World War, punctuated, by the Great Depression, the influenza pandemic itself. And of course, demobilization from the war was an event that is probably the most, comparable experience to what Hawaii is going through this quarter. But what followed was 30 years of tremendous economic growth, the so-called catch-a-wave period, a dramatic political transition as returning AJAs and people involved in the labor movement and whatnot turned over the territorial political establishment, the oligarchy, so to speak, of plantation legacy and all of that stuff you can read about in the history books. Well, that happened. I mean, that was in my life. And that 30 years of growth from 1950 to 1980, many of us look back on as, the thing that's kept us going for the last 30 years. where there's been nothing like that. We thought it was going to be like that for the last 30 years. And of course, Hawaii's sputtered ever since and managed to eke out a 2% growth rate in the last decade. I'm just saying, sometimes these events dramatically change the way people think about things. And it's happened before here in Hawaii. Here's what the GDP growth rate, these are my estimates, they're not official, but I've done a lot of work trying to get this pinned down. And this is my estimate of the GDP growth rate around 1946, 1947, minus 35%. So, I mean, in my estimate, literally my estimate in quantitative terms, Hawaii went through exactly this kind of experience, different origins, but the same, 1/3 of the economy went away overnight, which is essentially what's just happened in the last month. And what happened after that was one of the great waves of real estate investment and construction. I mean, you have to remember the tallest building in the state in 1960 was Aloha Tower. Think about that for a second. So everything, and when was the last time anybody punched a tunnel through the Ko'olau Mountains? When was the last time anybody even thought about building freeways? I mean, yeah, H3 was built later, but that's because it got hung up for 30 years because of the environmental movement. So I'm just saying, we did it once before. It could be done again. If you did it, if you just did it sustainably, it would be fine. Whatever, I'm just saying, things could be different, but they probably won't be. what we're going through right now is a combination of the domestic beatdown and, in the same sense that Hawaii is the best state in the nation in terms of the case count, we're the worst state in the nation in terms of the economic beatdown. So no state has been hit as hard, and it's because we cut off tourism, which essentially is, 15 to 20% of the economy for starters. But then when you add the shutdown of non-essential business, you basically double that, and now you're up to 30, 40% of the economy on hiatus. The national unemployment projections look gnarly. The CBO forecasts unemployment jumping from just under around 4% to around 15%, and then a long tail of persistent unemployment going out into 2021. Looking at it from the standpoint of the CBO projection in January versus April, you can see how many more persons unemployed they're anticipating. Well, here's Hawaii's data for actual April. So seriously, a third of workers in Hawaii are unemployed right now, and that's a huge number. You can see the jump in claims for unemployment on the left, and of course now the duration of unemployment is reflecting that initial impulse response. That will taper off. Both of these will taper off, and the trick for us now is to get it to taper off as fast and as completely as possible by restoring our principal export. We just flipped the light switch and took tourism to zero, which we had to do. And now the challenge is to safely reopen air travel. It's a necessary and sufficient condition for economic recovery in Hawaii. It's not possible to have economic recovery without a restoration of air travel and tourism, and it is a sufficient condition. The only thing you need to do to get Hawaii back on track is to safely reopen air travel and tourism, and it's not that hard. Screen, test, trace, and track. That's what you have to do. Like the TSA is facing the wrong way or whatever. Since we can't rely on the federal government because idiots are in charge, the TSA is not going to be the solution. So we have to do it here in Hawaii. If you get off a plane, we're going to screen you. And if we think you need to be tested, we will test you. And then we will isolate you until your test comes back. And then we will contact trace everybody you're in touch with. And then we're going to track your damn cell phone. I mean, if I were in charge, that's what I would do tomorrow, and we would have tourism back. But obviously it's more complicated than that, but not so much more complicated that it can't be done. Taiwan has done it. So there you go. Call up those guys. Call up your classmate from calculus in college because he's the guy doing it over in Taiwan. But this is the challenge. The passenger counts went to zero. They, on a monthly basis, they just dropped off a cliff. I mean, you can go through all these data. This is a visitor counts. We're going to get, April. It takes a while to get the monthly counts, which is why I use the passenger counts. I mean, seriously, you cannot leave this in place. And as I suggested earlier, this is industrial production. I mean, yes, the initial part is going to be V-shaped, and the trick is to get that to come back as fast as possible. We've done it before. So here are some of the historical experiences. We were just looking at industrial production. Here's industrial production at the time of the 1919 influenza pandemic. So it's been done before without computers. Let's just get on it. Here are the tourism data from the 1930s. And if you think taking tourism to zero has never happened before, you are wrong. Because in 1936, 1937, 6 months of dock worker strikes on the West Coast shut down travel to Hawaii, because in those days there weren't any airplanes coming from the mainland to Hawaii. And so for 6 months, Hawaii tourism essentially went to zero. And this is exactly the profile. So I've indexed these numbers to the pre-strike level. Pre-strike is 1, and you can see it basically goes to 0 and then comes back to 1. So it's not as simple as just letting the airplanes fly in, because we have to screen everybody. But in some ways, qualitatively, if not quantitatively, these are the 9/11 results for international arrivals and the 9/11 results for domestic arrivals. As I say, we've been through versions of these before, where the trick is to safely rehabilitate travel. And in the 9/11 case, it was creating the TSA. and then building a reputation as a safe destination through a credible intervention in transportation security. Right? That's the whole thing, right? So where's the Department of Homeland Defense? I don't know. We're going to have to do it ourselves. And that means everybody who gets off an airplane. And it's not just the tourists, you guys. It's the local people bringing it back from the mainland. I'll skip through quickly. I'm behind a little on time. Anybody who lives on the island of Kauai knows what it's like to have the economy shut down for a significant period of time. And here's the Hurricane Iniki experience, which is important for two reasons I want to emphasize. The first is that the initial recovery can be pretty substantial. Now, these are years. So for Kauai, we're talking 3 to 5 years, you know, maybe 2, but certainly 5 before things find a new level. And then the other point is that these kinds of events are associated with massive structural change. So you looked at the post-World War II data where people said, after this, after 2 world wars, a global pandemic, a depression, what the hell, we're gonna build the future. And that's what people did from the 1950s to the 1980s in Hawaii. After Hurricane Iniki, what they did was they said, well, if we're gonna replace the utilities, let's just make it all fiber. And the other thing that happened on the neighbor islands is that the nature of the lodging capacity shifted. Pre-hurricane, it was sort of 50-50 hotel and condo. After the hurricane, the risk of the next hurricane was distributed through securitization. So timeshare and vacation rentals became 50% of the inventory, right? You make the risk exposure more granular by distributing it across a larger pool of owner investors. And therefore, the brands that are involved in managing these properties don't have the risk on their balance sheet. They're exposed because they're service providers. They provide lodging services, but they don't own the building. And I would imagine that this event is going to have really profound impacts on the vacation rental industry, and that as realtors, we should be, you guys should be thinking about that. So I just did the standard undergraduate 50-minute lecture, and I haven't talked about housing. But I do have some of that material. So to get the Q&A session rolling, I will preempt some of those questions by let's look at the data for a second. Just observing sales volumes for a second across the state. I've run these regressions from 2013 through 2017, because in 2018, the wheels started to come off in Hawaii's economy. And it was partly just the underlying sort of lack of energy the economy has shown all decade, but also because a series of unfortunate events, the volcano on the Big Island, flooding on Kauai, and actually on Oahu at the same time, but record flooding on Kauai. And so you can see that in the transactions volumes in 2018, partly because of the normalization of interest rates at that time. Remember, the Fed was raising interest rates to try to, you know, reload its arsenal of monetary policy tools. Sales declined. They had come back to a certain extent more recently, but now I expect they're going to drop, and I have no idea by how much, but maybe not as much as the stock market. I mean, almost certainly not as much. The growth rates ranged from maybe 3 to 4% at the low end to 7 to 8% at the high end. It's intriguing to me that Big Island and Kauai were sort of the winners of the single-family home sales derby in the condo space, where urban condominiums have a sort of a separate appeal of their own. Oahu was doing a little better, but again, you see that fade in 2018 as interest rates normalize. And then some of the impacts of the meteorological and geophysical experiences on the other on Big Island and Kauai, where the growth rates were relatively high. Valuations had been remarkably convergent to the long-term path, or a version of the long-term path. So this is, sorry, I didn't put the labels in. Oahu is the dark blue, the long-term series. Maui is the next longest, the medium blue series, and Hawaii Island and Kauai are mashed together in the non-metropolitan portion of Hawaii as the lightest blue series. But they all have gone through the cycles and converged. So that, convergence was notable right up until first quarter this year. Now I expect there's going to be a little compression, but not that much. And, you can stay in your house. You don't have to move. In fact, right now you want to stay in your house. So even though people might be tempted to bail out, I mean, where would they move? Where would you go if you're leaving Hawaii because you want to find safe haven somewhere else? I think of the margins at which these transactions are likely to happen, the downward pressure is going to be relatively muted. And of course, it's not like the stock market where you can go to cash, right? People who are investor owners, yes, maybe they want to go to cash, and that's where most of the action is going to be. But you're not going to go be homeless, and sell your condo. So, okay, this is just one geographic comparison, but a reminder: Hawaii is California, so don't forget it. Here's an interesting data set that's pertinent to the condo market. These are vacation rental arrivals on Oahu, which decided in its infinite wisdom to enforce the 1989 ban. So they took a rule from the world before internet, before cell phones, and decided to enforce it in 2019. In fact, in August 2019. And you can see what it did. And then now we've beat it down further with the virus. But it was already going to cost Oahu $350 million in foregone tourism receipts to just enforce the vacation rental ban, which is the same amount the SARS cost Hawaii, by the way. I should have that calculation earlier. I skipped over it. But what happens when people's vacation rentals no longer are cash flowing positive? People try to sell them. And so in the Oahu data, you see this pileup in the inventory, in the condo inventory. And for the reasons I suggested a second ago, anywhere investors are looking for the safe haven of cash or treasury securities or whatever asset class they're fleeing to, it will exacerbate this inventory pileup. Listings had begun to drift off in the last year. I imagine they will drop precipitously now, and I do have some neighbor island data which Hawaii Information Service graciously shared, which showed that this was already happening in the latter half of March, and I presume it continued in April. So the activity will subside and sales volumes will subside. I don't think valuations will by quite as much. And I'll just add on, because housing is a long-term asset, and you really need to look through this crisis, the uneven recovery to follow, and out into the mid-2020s, let's say, for some guidance. And there I would temper enthusiasm just somewhat. The long-term population trend has been flattening, and the last few years, of course, we've had population decline in Hawaii attributable to net domestic outmigration. Most of that is associated with post-Iraq, post-Afghanistan disengagement and downsizing of the military force presence in Hawaii. I have no idea where the military is going to end up, but I think that this range of 35,000 plus or minus, being sort of the post-Cold War norm, maybe 40,000. I think that's a plausible conjecture, and clearly that's going to change. That's at risk of changing because of what's happening to the federal budget. Either way, we haven't really been building homes, but it's useful to remember that we used to build homes in that period I mentioned after World War II, where after 30 years of getting whacked over the head and dying, people in Hawaii said, let's go build something. The idea here is that we could have a version of that, without polluting the environment. That is, there's a way to build without being environmentally or culturally irresponsible. I think we've gone way too far, and it's ridiculous that they built more houses in Honolulu in 1928 than they did in 2019, in each case before a big recession / depression. So, okay, you've seen these data before, and I won't beat down on that anymore. I'll also mention that that 30-year period after World War II was also the period in which we built tourism. In fact, all we've done for the last 30 or 40 years is just sit on the same inventory. Yes, new buildings come, old buildings go, but all of the net growth, if there has been any, and on Oahu there's barely been any, but all of the net change in the visitor plant has comprised vacation rentals, both on Oahu and especially on the neighbor islands, which has fewer conventional lodging units today than it did 30 years ago. So if we're just going to do this with a population that's flattening and a military that is reverting to its post-Cold War configuration, yes, it's possible that last year was the time you should have sold your house and left Hawaii for good. I'm hoping it won't be that way in the 2020s, but that's a long-term consideration to keep in mind. And I'll stop here because the rest of these data will make your brain hurt. So let me stop sharing and look at the questions and answers. And I believe our fearless leader, Ethel, and her associates are going to
Hi, Paul.
help guide the discussion.
Here's a question for you. Do you have any thoughts and forecasts on defaults on credit / loans / foreclosures we may start to see 6 to 12 months from now, and if that will have any effect on pricing?
Yeah, I mean, the answer is no. I have no idea. It's weird right now because there's all this emphasis on forbearance, even forgiveness. I mean, these are forgivable loans, and I'm like, a forgivable loan? That's a gift, right? That's just like a grant. Why didn't you just call it a grant? And you make people jump through all these hoops and fill out a PPP application. You're just going to give them the money anyway. So, WTF? You know, why make it so complicated? Why build a Rube Goldberg contraction to give away money? But yes, default rates are going to go up. On top of that, you're going to have this weird sort of deferment, right? You're going to have to think about the delinquency rate, sort of the normal delinquency rate, and then on top of that, you're going to have this sort of deferral rate, a proportion of mortgages that aren't current because they got permission from their mortgage servicer or the underwriting or the underwriter or whoever, you know, the lender to you know, not pay their full mortgage or whatever. I mean, it's going to be all so ad hoc, and then unwinding this stuff in the fall, it's just going to be crazier after. I mean, there doesn't seem to be any like hard and fast rule about how this is all supposed to unwind, and it's going to be like a 900, you know, a 2-ton elephant, a ballerina doing a pirouette on the stage without crushing it. So yeah, it's going to be gnarly. I will say that if you look at the, here are the interest rate data, and you remember QE1, QE2, and QE3, right? Well, now we have QE4, and QE4 is this massive injection. You can see all the way at the right end of the chart here. This is the Fed's balance sheet, and they had begun to acquire securities again last fall, beginning in October, as a preventive measure against the risk of recession in 2020. But of course, after the coronavirus, they've had to, and they committed totally to expanding their balance sheet. I mean, they're going at about a 3 trillion rate, 4 trillion rate right now in about 2 months. I mean, it's going to be crazy updating these are weekly data, and it's already gone 2 trillion in like 2 weeks or 4 weeks or something crazy like that. Why? Because all of the stuff that the Congress has included in the CARES, you know, in those fiscal stimuli, and I can't keep track of them. They're 3 or 4, I can't remember. and but $2 or $3 trillion, who knows? All of that stuff is being backstopped by the Federal Reserve. So the idea is the Treasury says it's going to give you money in the form of a forgivable loan. So so where does the bank get the funding for the loan? Well, the Treasury is going to buy these securities that the Treasury is issuing and inject bank reserves. So you can see the reserves at the bottom, they're Fed liabilities. And so not only is the Fed using the customary quantitative easing securities, mortgage backs and US Treasuries, they've added asset classes. So there's a commercial, there's a CMBS tranche now, and there's a municipal bond facility, 500 billion or something, 350 billion, I can't keep track, where the Fed will backstop issues of state and local governments to do what they can with, in the case of Hawaii, 3 or 4 billion, 3 at the state, 4 including the counties. So yes, on the one side of the list of risk factors, there are going to be increased delinquencies, and there's this weird deferral thing going on. Will that actually turn into defaults? That's the $64 bazillion question, because it's possible that the elephant pirouette we could actually pull it off and unwind all of this somehow in the fall. It seems to me like it's going to be really labor intensive, because you should see how the front end is. I mean, the front end is lending, and I don't know, you guys know, my wife's a banker and she's in the other room she's been working for a month straight, no days off. She rolls out of bed in the morning to her computer, and she rolls back into bed from her computer at about 1 in the morning, and all she does all day long are PPP loans. Don't tell anybody. So that's cray over there on that side, and those are the guys that know what they're doing. Yes, it's going to be gnarly, but it doesn't have to be catastrophic at the other end. But as with everything, it depends on what we do. We don't have to have a second wave, but it depends on how it depends, right? Depends on the reaction function. How do we now react to what the epidemiologists are telling us? And in Texas, they have a governor that says, my life's not worth anything. I'm 70, so what the hell, right? My job is to leave a world for my grandchildren. And I'm like, dude, knock yourself out, stay the hell away from Hawaii. So that's, different states are doing this differently, and Hawaii's going to have to make some choices over the next couple months. And the reason the projected death count has doubled in a week is because you can see what other places are doing. You can see the way it played out in Sweden, and you can see the way it worked in Taiwan. And the more you want to be like Sweden, the more you should expect to have an outcome that's different from Taiwan. The housing market, I think we know how to do this, you guys. I think it's manageable, but it's going to involve a lot of hard work and a certain amount of forbearance in the general sense. We're all going to have to be, resist the temptation to cut somebody off, because if you wait 5 minutes, it might be okay. I mean, we could get lucky and Hawaii could establish itself as the safest destination on the planet, which, next to Taiwan, which nobody actually wants to go to. That's not fair, but which, you get my point. We can do it, but we would have to do it. It's just not going to happen. We would have to do it. There are a number of other, a lot of these questions, by the way, have to do with, mortgage delinquency, default, foreclosure risk. And as I say, my general feeling is that we've accepted that there's a place for forbearance in the current environment, because it's not that we've never been through this before. And I've asserted that in the 3 cases, the pandemic a century ago, the post-World War II experience of Hawaii, I don't know about the rest of the world, but that's how we did it here. And then Iniki on Kauai, which has lessons for everybody to learn. It can be done. How you do it matters. And in this case, we have the tools now. This is another really important point. Digitization, right? The algorithms were already there. Some people were exploiting them more than others. Some people were slow to adopt, slower than others. But it was just a fact that already 3 years ago, a majority of mortgages in America were being issued algorithmically, meaning that the only human involved was somebody that had to sign their name because they're of sufficiently high executive status in the company that they're on the hook if something goes wrong. But the nation's largest mortgage lender before all of this was Quicken. So what that tells you is everything you were creeping towards, like 3D virtual open houses, you should be running to right now, right? You never want to have another open house for as long as you live, because that may be the guy that's the reason you die. So why go there? At least until there's a vaccine. And you may say, well, but we need human contact. We're realtors, or, you know, knock yourself out. Me, man, you know how I shop? I go to Target.com and it either comes to my door or I drive through the parking lot and they throw it in my car. So that's all of these things we do are possible in different ways. Just as evidently you can do banking from, you know, your bedroom. You can be a banker from your bedroom. I'm pretty sure you can do much of what is involved in real estate at home. And I was telling Ethel yesterday, I learned a new expression, remote online notarization. That's the thing. I don't have to go to a notary. Good, because that was a pain, and I never understood what the hell was that all about. Even, you know, like let me crimp the paper. So yeah, things are going to change. There's going to be a bunch. Look, there's going to be a bunch of millennials who already figured out how to do this better, faster, and cheaper than the way you've been doing it all your life. And they're going to drop kick our sorry boomer asses out the door if we don't all move in that direction. With any luck, they'll also, you know, be smart enough to take over the politics. And I don't know, in a world with Prince Jared, it doesn't seem like you have to be that smart. I'm just saying, there are going to be a lot of things that change really quickly. Digitization, what we're able to do in financial services, in transaction management electronically now, is really remarkable. And it could very well be that this is the final impetus moving real estate transactions towards the E-Trade model, right? You don't call up your broker to buy stocks, right? You get on your phone and you do an E-Trade transaction. I mean, that's guys like, you know, anyway, people were talking, the Peach brothers were talking about this 30 years ago. As soon as internet came along, the guys at Title Guarantee were like, oh snap, everything's going to be online. We better start doing that. So, okay, what else do we have? Vacation rentals, I see in the questions. Yeah, man, what a bloodbath, right? I will still say this. If you go back and look at that slide on vacation rentals and on the post-Kauai experience, think about this for a second. Think about fundamentally what's changed. So in the case of real estate, residential real estate transactions generally, fundamentally what's changed is that it's already been increasingly possible to conduct transactions without as much human contact. You don't have to have as many meetings. They don't have to be sequential, right? Where you have a meeting and then you go to another meeting and then you sign Z papers. And so all of that stuff already was going electronic. In the case, so fundamentally, the transaction cost was being reduced with information technology and artificial intelligence and algorithms. That was already the case. With timeshare, it's kind of the same. I'm sorry, with timeshare is a whole nother securitization story. But with vacation rentals, two things happen on the two sides of the market, supply and demand. On the supply side of the market, if you wanted to enter the lodging industry back in the day, the way you did it was 500 rooms at a time. You had to build a large building, a building you owned, and when the hurricane came and blasted it, you owned that, right? That barrier to entry meant that the participants in the industry were small in number, and tended to behave oligopolistically. They tended to behave strategically. They watched what each other did. Their pricing was based on what the other guys did, sort of like airlines. There's 5 airlines. They all have, you can't fly one seat, you have to fly 300. And so those barriers to entry meant that only large, strategic, contestable rivals could participate. And hosting apps, this blew that up. All of a sudden, you could participate in the lodging industry by converting the spare room in your house to a vacation rental. And you become an Airbnb host, and the barrier to entry disappeared. And of course, on the neighbor islands, people have figured out an accommodation where, well, here's how we're going to do this. And on Oahu, people just said, no, we're not going to do this. And then for 30 years, they pretended for 30 years that we weren't doing it. And then one day they woke up and said, okay, now we're going to enforce it. And that was last August. On the demand side, that's the supply side. On the demand side, what changed? On the demand side, this also affected things, because now you go up on your phone and you figure out there's this place that you didn't know existed before because you didn't have Google Maps. Because you do have Google Maps, you can go up on your phone, find this place in some remote part of the island that's not in the ghetto, in the resort ghetto, and you can go there and stay in an Airbnb or whatever. And so the information asymmetry that prevented visitors from finding these hidden gems was dismantled by the hosting apps. Why is it called Match.com? Because it lowers search and matching costs. So now there are more people which have the information that allows them to go to the places that they wanted to in the first place, but thought they had to stay in Waikiki in order to do it. And so demand increased, supply increased, right? The supply curve increased, the demand curve increased. And we know that prices can go up and down when both supply and demand increase, but for sure quantity increased. That's what you see in the data. We have more lodging units, and virtually all of the increase is in vacation rentals. Along comes the coronavirus and blows up that model. The question is, for how long? Because it seems to me that it's much easier to shelter in place in a remote cottage on the backside of Kauai than it is to shelter in place in a 500-room high-rise in a destination resort area. These things all have to be sorted out, and the law, and the emphasis, if you listen to what the global brands are saying, they're emphasizing safety because they're not going to dismantle the building, right? So they have to operate these buildings more safely, build credible reputations for safe habitation, safe mobility, and that's a challenge. For the vacation rental industry, it's going to be more, it's more granular from the get-go, and different people will be, experimenting with different approaches where they're legitimately operating, and that whole question on Oahu remains to be sorted out. Because, it's just stupid, sorry, but it's ridiculous to think that prohibition is actually going to work. Prohibition never works. So the only question is, when will the jurisdiction and the marketplace figure out, as have done the neighbor islands, how, more than Oahu, how you dial around the rules of the game so that this kind of economic activity can occur in the dispersed spatial format, right? We've been consolidating the economic activity in these nodes, and there are certain economic advantages to doing that, right? You limit the contagion of, you limit the radiation, congestion, and other environmental or cultural externalities. You can put all your effort into, keeping the streets in Waikiki clean, but yeah, those things have yet to be worked out. Let's see if there are some other questions that take us in different directions. You guys had pre-submitted questions. Hold on. I think most of those questions I anticipated because I saw this list earlier and tried to build enough of the answers into the one thing I left out, commercial real estate. Let me just quickly comment on that. because we're running out of our second half hour. You know, I've listened to commercial real estate people. I'm not one of them. My wife used to be, but now she's having to do this. And it seems to me that some of the same longer term structural changes to which I alluded in these other contexts were actively influencing outcomes in commercial real estate. So let's go through the list. Retail, are you seriously telling me we need 2 million square feet of retail space at Alamo Center? Even before the coronavirus, I wasn't convinced of that. I mean, I'm happy that we got the construction and whatever, some of the new brands, and it's kind of cool, and it reinvigorates the whole scene. But you know, for retail space to double in size in a location like Ala Moana, Waikiki, where the lodging hasn't, how's that going to work out? Not to mention this thing. Do you not have Amazon Prime? I mean, really? So that already was playing out. Brick and mortar was already, regional malls. I mean, Windward Mall, oh, brada, that's my mall, man, is looking kind of sad. That was already happening before this event. And this event is like a shockwave amplifying all of the problems with brick and mortar retail and highlighting the amazing advantages of online everything. So whether it's strict, you know, retail or dining out, are you serious? Food at home was half of everything. Food away from home was the other half. 8 weeks ago. 2 months ago, half of all the meals in Hawaii were eaten away from home. And half of all the meals were eaten at home. And of course, the entire distribution, the entire supply chain was set up half-half. And now all of a sudden, we're all at home. And the supply chain is having trouble making that adjustment. The farmers are all thrown off because they were only going to the restaurants because that's where the big money was. So the retail space, traditional retail, you know, and merchandise and food service are really going to have a shakeout. Versions of this exist. Office space, this one is fascinating to me. I keep referring to my wife. So the bankers all lost their offices. They all got kicked out of the office. They got their walls and doors taken away. They got crammed into the incredible shrinking cubicle, which, you know, used to have 350 square feet of space per worker in downtown Honolulu. And then it went to 150 to ensure that we could all transmit infectious diseases to one another from whichever one of us had kids at daycare, right? Where the kids are always sick at daycare. The parents bring it to work. Now everybody at work is sick. But before it was the common cold, and today maybe a little worse. So that whole thing's going to have to be rethought. I mean, just the institutionalization of social distancing, right? I'm thinking booths. Remember booths in restaurant? Remember when you could go to the restaurant and there was a booth and you could have a private conversation and, you know, not have to listen to Gladys's Portuguese harangue about whatever in the table next to you. And then it became fashionable to rip out all of the soundproofing, make these hard concrete surfaces and metal ceilings so that and put tables close to one another so that all the millennial noise could drown out the conversation at your dinner table, right? I mean, okay, so these things are all going to change. Warehouse, I would say, we never had enough of it to begin with. And if there's a lesson coming from all of this, maybe we went too far with just in time and, you know, supply chain reliance, and maybe we should backtrack a little bit, which means building more warehouse space. Here's another example. I learned this the other day. This is public knowledge. Young Brothers is applying to have fewer voyages per week to Hilo and Kahului. Okay, that's just the reality of the world that they face in the 2020s compared to the one they had 10 or 20 years ago. Not as many voyages are needed. Sorry to say, it's a neighbor island thing, but whatever. We're talking integer constraints. When you go from 2 voyages to 1 or from 3 voyages to 2, that's a huge difference in the way the supply chain is going to work on the neighbor islands, and it means you need more warehouse space. So those things were already going to happen, and then the coronavirus adds other elements. So I would say, to me, that's opportunity in at least two different ways. One, structural change means a different allocation and configuration and maybe sheer quantity of commercial space. I imagine Macy's is going to be a condo. You know what I mean? Seriously, I'm sorry, you don't need Macy's, Target, Needless Markups, Bloomingdale's, and what's the other one? Nordstrom's. You need all of those guys at Ala Moana in a world in which the number of lodging units on Oahu has never been higher than it was in 1986. I doubt it. So all of those structural changes on the one hand, but then on the other big change, the Fed stands ready to buy some number, 300, 350, 500, I don't know, you can look it up, in CMBS. That's interesting. The Fed will stand behind, will be the liquidity backstop to commercial mortgage-backed securities, the secondary market for, the origination that's going to be going on. And there's going to be a bunch of corporate bankruptcy, workouts, redefinition, readjustment from retail on down. Everything I've talked about. Lodging, are you serious? So to me, that sounds like a lot of work, which means a lot of opportunity for smart people to rise, and for people with innovative ideas, for people with better and faster ways to do things, to have an opportunity. And that to me sounds really intriguing. Commercial real estate is like a small subsegment where a small number of really sophisticated players can participate, and maybe it might open up a little bit just because the sheer amount of churning and turbulence that's going to have to be managed. But it is manageable. I mean, I don't think we're going to see collapse. We're going to see a chance to do things in a better way, and maybe in some cases a chance to redeploy assets that, if you thought about it very deeply for very long, you probably realized had to be deployed differently eventually anyway. Ethel, I think we're reaching the end of our extra playtime here.
Yes, mahalo.
Extra
Big
innings.
mahalos. Big mahalos, Paul, for providing us with such a wealth of information and data. We look forward to having you back with us in June and July. So members, please continue to check the Hawaii Realtors e-news for details on dates and times for these future sessions. This ends our session for today. Stay safe and healthy, everyone, and have a great week.